Good evening and welcome to IHW Council's special web series on women's health. Today we will be talking about the implications of COVID-19 on infertility treatment. I'm Anisha Nair Dhawan and you're watching our exclusive show right here on Facebook. The ongoing pandemic has raised serious concerns among everyone, and women are certainly facing the brunt of it. The impact of this virus on their pregnancy, childbirth, family planning, or even the more regular and common needs such as menstrual hygiene, nutrition, and mental health are among many of those issues that are bothering women. And there is one more thing that is causing immense suffering to many, and that is the inability to conceive. Infertility over the years has emerged as one of the most common health problems that many young couples are facing. According to the Indian Society of Assisted Reproduction, infertility currently affects 10 to 14% of the Indian population. And the scenario is far worse in our cities, where 1 out of every 6 couples is impacted. Now, our show today is special as we're going to discuss every aspect related to infertility and how impacted women and couples can best address this during the time of a pandemic. And to guide you for that and to answer all your queries on this, we have Dr. Sunita Tandulwadkar, founder and medical advisor, Solo Clinic, Pune, who's joining us now. Welcome to the show, ma'am.
It's my pleasure.
And thank you so much for being with us. We're so privileged to have you with us. A quick word on Dr. Sunita Tandulwadkar. She is the head of Department of Gynae at Ruby Hall Clinic, Pune. She's also the chief of the IVF and Endoscopy Center at Ruby Hall Clinic, Pune. She is the advisor and consultant to Dr. D.Y. Patil IVF and Endoscopy Center in Pune. And she's the founder and medical director of Solo Clinic IVF, which is a center of excellence in infertility treatment in Pune. She's, of course, the founder there. She also holds the post of the president at the Indian Association of Gynecological Endoscopists, and she is the chairperson of the Maharashtra State Chapter of the ISAR. She has many publications and awards to her name. She has won the Pride of Foxy 2020 award, the Bharat Gaurav Puraskar 2019, and she has won the ISAR Best Personality of the Year 2018-19 as well. She's an accomplished doctor, and thank you so much, ma'am, for being with us. Before we start talking and taking questions, I would like to request all those watching us, our viewers, to keep sending us their questions via the comment box. Keep typing in your questions as and when they come to you and when you listen to ma'am. And we will try to take up as many questions as possible over the next 30 minutes. And if you have, we request you to please like and comment on Facebook, like our page, comment and share this page with all those you feel could get benefited out of all the conversations that we have on women's health right here at the IHW Council page. So let's begin, ma'am. The COVID situation is not easing up. And there may be a few couples who have put off their family planning plans or their plans to seek assisted reproduction treatment because they feel the pandemic is not the best time to take a lot of risk. What would you say to them?
First of all, let me congratulate you. Your company is doing fantastic job of this public awareness, and sitting at home, people can hear, watch and clear many ideas. As you rightly said, infertility, yes, increase in a trend because the couple want to plan little later in a life, and then they may face the problems with diseases like fibroids and all, which otherwise would not have troubled them. Now, this COVID pandemic has taken a U-turn in everyone's life. From a small person to the richest man, it has taken really, globally, it has taken U-turn. Now, those who wish to plan the pregnancy, or if they were on the process of taking the treatment and suddenly in the month of March in India, they have to stop it. It's not only that much, dear. There are certain couple, international couple who have come. They have traveled from Yemen and other places and they are stuck here. So, Anisha, This problem is faced by many more than can you expect. Now, when the couple comes to us now, how long we can wait, how we can proceed, few important things you need to understand. First is how much they have a family support with them. Because in this pandemic, if they are continuing the treatment and if they become pregnant, it's 9 months more to go. Naturally, you are avoiding people coming at home for work. You are avoiding going outside yourself. Do you have a domestic help in house? Do you have the family member who can help you to carry in this pregnancy? It's so many issues they have to work. Also, financially, it is little bit troublesome situation going on for all. So the issues are, one, do you have a COVID in your family, in your building, in your society, whether your area is green zone? All these problems one has to think over before you can advise the couple whether they can go for treatment or not.
Right, ma'am, but when in the initial few months of this pandemic, globally also there was experience, people were battling with this starting January onwards. So from January to April, a lot of people have had experience of this virus and how concurrent treatments can go on. They are also, critical care patients who need treatment. They can't stop because of COVID. So now protocols have been set up that for infertility treatment, these are the protocols. These are the safety measures people take. So if all this has been set and, at home, you do really want a family, and whether it's financial resources or your home setting, you have made arrangements for those. I mean, like if I don't have a domestic help at home, fine. I mean, that's a situation. Should I put off my decision of trying? That may change soon, may not change. I may just get a lifestyle where I'm used to not having a domestic help. So should I go ahead then? If you have safety protocols, what is the risk?
Anisha, the most important thing about the fertility is the age. No one knows the pandemic, how long it is going to be there, 3 months or 3 years. So the age, as the woman age advances, the chances of fertility decreases, their ovarian reserve is decreasing. So what are we doing? Are we closed down? Yes, in the month of, you can say 22nd March or April, shut down for the work because there was complete lockdown and curfew. But we have started from May. So what are we doing is, first is try to do as much online consultation as possible. When the COVID you are going to get into, when the two people are sitting in front of each other without the mask, without the face shield, and for more than 30 minutes. So how can I reduce this distance? How can I reduce this time zone? So first is, the first meeting you can do the teleconsultation with the doctor. For small things, don't crowd in the clinic. It's not safe for you and for others. So teleconsultation is the first important thing. Then, of course, when you are taking medication, when you are taking injections, we have to start this. So after the telemedication, first thing we take is we call it as a triage. It means, do you have a cough, fever, your family, and as I said, in the building and association. If you don't have it, then we increase their visits absolutely as and when necessary. When they come for the checkup, again, we give them a certain time schedule. So that previously in Jan, if anyone can come in my clinic, you will find at least 30 to 40 couples sitting up and down. This now is 2 or 3 people, couple at a time. So if I need to have only the wife to be seen, the husband should be either in his car or in the garden down or in the waiting zone, which we have to create for them. Do you understand? Then decrease the visit, again, examination time of the couple. So what are we going to do is, if she has come for a sonography, just have a quick sonography and take a decision. She may be in a different phases of a treatment. So accordingly, you guide it. So decrease the number of a visit. Third thing is everyone wearing the face shield, everyone wearing the N95 mask, spraying that examination table or cleaning with the surfactants table between the two patients. It's very important that we will not get from each other. So certain important thing, wearing a PPT kits is a must. So when patient come even in the hospital, in the clinic, apart from N95 mask of our own, we don't know whether it is new. We change their mask, we give them a face shield, we give them a PPE kit, and every staff, every sister, every assistant doctor is wearing those PPE kits. So all these things are very, very important. Your patient triage, and once you cross that triage, then more and more we are doing teleconsultation, decrease the visit, decrease the number of you feel that there is a traffic because now it is opened up, come 10 minutes before and be seated in your car, and when your timing is happened, just enter in. Don't accompany with your sister-in-laws, mother-in-laws who are elderly, only the husband. Then we did another most important fear, Anisha, they have is if they start, for example, IVF, that is a test tube baby treatment. What will happen if they catch up during the treatment? The treatment is very expensive. The treatment involves a lot of injection taking. Then what we do is once we decide we are taking them in a treatment protocol, we are doing COVID testing of both the partners. And only if they are negative, then we proceed. Now,
right. Ma'am, we actually have a question on this very topic. Now, you're saying before you start treatment, you will test them for COVID, both the husband and wife. The question that we got is, what happens if I test positive for coronavirus during the treatment? What if I started my injections? What if I'm taking the medicines and after, say even after a transfer, I test positive? Then?
Yeah. Now, if you are on certain 10 days of injection approximately you need, and we test you before you start the injections.
Okay.
But sometimes the test, we all know that it has 80% sensitivity. In a very early stage, if you do, it still may come negative. And during 7th day of an injection, patient tests positive. She start cough, she start fever. And if we test it, and if she's positive, we have to cancel her cycle.
Okay.
We have there is no alternative for them. So patients also, what I observed now last 3 months when I've started, out of maybe 80 patients which I have done, only 3 came positive during the injection process.
Ma'am, how many, can you repeat, how many patients?
80 patients I have done in last 3 months. 3 came positive during injection, and we have to cancel. It also tells me that the patient also takes tremendous care of isolation, self-distancing. Now we know our understanding of corona, which was there in March and which is there in September, is totally different. We know that if we keep a social distancing, if we don't go for a gathering, if we wear a mask, and if we sanitize, we call it as a PMS, not SMS, PMS. That is physical distancing, mask, and sanitization. Every patient, we provide this WhatsApp card, and they are taking. Now, your important question is, after the embryo transfer, if they come positive, that's a very unfortunate thing. Previously, that's what I say. In March, we were thinking that corona is not transmitted to the baby. Definitely, corona is not going to kill the embryo. You can still be pregnant, but the effects of corona on the pregnancy, whether it will lead to abortion, whether it will lead to preterm labor, is little uncertain. Nowadays, we are seeing that corona may cause abortions. We are seeing that corona may be transmitted to the pregnancy. So in a March, we were saying corona is not transmitted to placenta to the baby. Now in September, we are seeing there are records where it can be transmitted. So the pregnant lady also need to take so much precaution because immunity is decreased during pregnancy.
Ma'am, then I just want to understand from you that supposing after the injections the patient has tested positive and you decide not to go for the embryo transfer, but should they try on their own? Because what you're saying about corona being transmitted to the baby, the research is still very sketchy. Some people are saying that it doesn't cross the placenta and babies are safe, babies are delivered without corona, and during breastfeeding and care, all precautions are taken so that the baby doesn't get corona. So should I try on my own even if I have tested positive for corona?
Yeah, for a spontaneous conception.
Yes.
Also very important question you asked me, and frankly speaking, no obstetrician has definite answer for it. It depends upon how are you work from home, are you continuing, do you have domestic help, if you got into the corona. See, first of all, if you have positive and if I'm telling no treatment, with the corona positive, you need to quarantine yourself from the rest of the family member, which include your husband also.
Okay. All right. So physical distance itself will not make it possible for you to try.
If you are positive, be isolated yourself.
Okay.
Second thing is, don't think after 1 month, once you became positive, now you are got immunity, because in last week only the third recurrent positive case is quoted, and that was in India, in Pune. The first case in Hong Kong, they reported patients within 2 months because the antibody titers are not there. Believe me, I do have a patient who was positive in April, very good health. And in June, we did embryo transfer. We got results. She is very much. We tested her antibody because she's pregnant now. Her antibody titer is 0. So only in 23% antibodies are produced. So you still are at risk of redeveloping corona.
But that means you have to never let your guard down. Like for that lady, she's got an embryo transfer, she can never let her guard down, right?
Yeah.
Or anybody for that sake, even if you have contracted corona. Ma'am, we've got another question coming in. If a patient has stored sperm, embryo prior to the lockdown, will they be affected by coronavirus or COVID-19?
At present, their embryos are safe. They are in liquid nitrogen tank. The IVF labs are safe. There is no coronavirus in the lab. So embryos which are frozen, they will remain safe. When to transfer is individual's decision.
Okay. So frozen ones are completely safe from corona. There is no threat of contraction there. Ma'am, from your practice, for those who, you said 80 of your patients, only 3 tested positive. So how was the journey of these other 77 patients who have taken treatment during the COVID time? Is it smooth sailing? Is it more stressful? Could you tell us a little about that?
I think, before the embryo transfer or before the IVF, a lot of counseling is needed, lot of reading material we need to give to our people. We made WhatsApp cards even to our pregnant woman. But I do have at present my 4 pregnant women having corona positive. They were at home. They don't know from where they got in. Now, yesterday night, frantic call from one of my patients, 20 weeks pregnant. She's negative. Husband got tested positive. So it may be the family member is positive. So what was important to do is her testing, rest of the family members testing, isolation of her from everyone, irrespective of their are positive or negative.
Okay.
And connect them to my COVID physician who keeps on checking them at regular interval with telemedicine.
All right. Ma'am, we are getting more questions coming in. When can one resume fertility and medical treatment? You just said that take a call according to your age, right?
according to your age, your fertility status, duration of marriage, how impatient you are, and what family support you have. There are many things which need to be. But corona positive or corona negative is not affecting your ovarian reserve. For example, a disease like tuberculosis, endometriosis can damage, but probably corona is not yet proven to damage your reserve. But advancing age, what my suggestion to my patient is, if you test yourself, if you are corona negative, get made your embryos and freeze them, because age of egg, age of embryo matter. Then your chronological age, you want to wait for 1 year, let vaccine come, take the vaccine, become free of this, and then go for, that is also not an issue.
Ma'am, one question we have got from our Facebook user is, I've been diagnosed with cancer and chemotherapy is recommended. Can I still attempt to freeze my eggs? We're talking about freezing eggs. Can this particular patient who's been diagnosed with cancer go ahead and freeze her eggs?
Absolutely. She can freeze her ovarian tissue. See, fertility preservation is one of the most important thing which we are following at Ruby Hall also. What's important is there are two issues. If we have to have a team, which we have at Ruby Hall, oncosurgeon, oncophysician, and the radiotherapy people. Now, if they say that the disease is advancing and we cannot wait even for a week for injections to be given and retrieval of egg, then we take out the ovarian tissue and we can do preservation of the ovarian tissue. Corona testing, of course, we have to do. Here, most importantly, we have to check is malignant cells are not there in the ovaries.
All right.
Maybe that is a very important topic you should take some other time.
Yes, ma'am. So you're saying that you take the tissues from the ovaries, you test them for malignancy. If it's clear, then you will preserve them to be used in the future for childbearing.
Absolutely. There are three indications apart from oncology. You can freeze your one ovary and prolong your menopause. At 50, you can do the ovarian transplant back.
All right. So science has really made a lot of progress. Ma'am, there's a question coming in from a user. She says, ma'am, I'm pregnant. Is there a risk that a COVID-19 infection will affect my pregnancy outcome?
If you are pregnant, but if you are not COVID positive, beta, please don't worry at all. Keep yourself positive, hydrated, build your immunity, take good diet, more of a proteins, and try to have teleconsultation with your obstetrician. Avoid going unless it is necessary. I request all my pregnant women to buy one BP apparatus. It is a digital. And once in a week, they should take 3 times in a day their own blood pressure. They should have their own weighing machine and keep on checking the weight. So meditation, yoga, everything she should continue. Don't worry, she will not catch up.
Right. Just be safe and use telemedicine and the options that ma'am has suggested. Ma'am, another question that is coming in from a Facebook user is, how long does it take to get pregnant with IVF?
It depends upon for what you are doing IVF. If your IVF is plain, maybe your tubes are blocked or anything, it takes me 4 to 6 weeks to make the embryos and another 2 weeks to get the embryo transfer and result. So in 2 months, usually those who are coming from outside, we tell them, you have to stay with us minimum of 8 weeks to get the pregnancy.
All right. Ma'am, does it always, is IVF always successful in the first run itself? I mean, on an average, I think the question is, how long does it take to get pregnant with IVF on an average basis?
The IVF success depends upon so many factors: age of the couple, age of the male partner as well as female partner. Then for what we are doing IVF, how is her uterus, how are her gametes, whether the first two IVF are always more successful than subsequent IVF, whether we are doing a fresh transfer, we are doing frozen transfer, what is her ovarian reserve. So many factors are involved. But on an average, if I say below the 35 age group, the success rate may be between 40 to 50%. But if we make more embryos and if I can do 2 times transfer, the cumulative pregnancy rate may be increased. Younger the patient, 25 age, the success can be as high as 60-70%. But it is never 100%. I don't know. I need to make it very clear on this ground to all the people in the society, those who are saying you 100% result, otherwise money back, please don't get fooled. Nowhere in the world there is 100% result in IVF.
All right. Do go with that knowledge, and that's a caveat that everybody must keep in mind.
It is better to under-promise and over-deliver than over-promising and under-deliver.
Ma'am, we have another question coming in. Does IVF increase the risk of preeclampsia?
Yes. IVF do have its own little bit disadvantages during pregnancy. And that's why we tell all our patients, actually, frankly speaking, to your knowledge, I was not doing obstetric practice in 96, 97. I had stopped it, but I restarted because every IVF pregnancy is high-risk pregnancy.
It should be monitored.
Yes. So chances of developing the blood pressure, preeclampsia, chances of developing a blood pressure during pregnancy after 5th month are higher in the IVF conception than in a non-IVF.
Yes, ma'am, that's true. I know my cousin's wife had this condition and she had a natural delivery. So I think there may be a higher risk, but many women who do not go for ART also have this, and everybody must be alert for this and monitor their conditions.
Absolutely. Damaging factor during pregnancy. Excessive weight gain can give a blood pressure and diabetes. Advanced age can give you diabetes and blood pressure in later part. Your family, your mother had, your elderly sister had. You can have a blood pressure during pregnancy. So be cautious in what you eat during pregnancy.
And also, ma'am, how important is stress and overwork? Because I saw this with my cousin's wife. She was on her feet working 12 to 14 hours a day. I mean, she was pregnant, but she was doing this. And she was stressed as well. And then, she just suddenly her blood pressure shot up.
This is not only during pregnancy, even in ART treatment. That's why counseling is important. That's where the stress affects your egg quality, quantity, your implantation results, and during pregnancy, it affects everything. You can have a small size baby. Your growth is retarded because of a stress. Stress gives you diabetes in pregnancy, everything. Stress is not a solution for everything, but problem of everything.
So we need to relax as well. Ma'am, another question coming in is from a Facebook user. Is the risk of miscarriage higher in IVF?
I won't say that unless IVF has, as it is a 10% risk for the common population, the same is. But sometimes in IVF, there can be a multiple pregnancy, which itself may be the cause. We have done IVF for elderly age group. So genetically abnormal embryo, if got transferred, the chances relatively gets increased.
Okay. So it is depending on other circumstances. Per se, the rates are pretty similar to normal pregnancies. All right, ma'am. One of the users is asking some advice from you. Please advise us on normal conception and keeping reproductive organs healthy.
Very important and very good. So, what is important is the lifestyle modification. Nowadays, we are seeing the youngsters with obesity. Obesity affects your hormones, makes your cycle irregular, makes your ovulation off. It affects the egg quality, quantity, everything. So, those who wish to plan the pregnancy, ensure that your BMI, that is your weight, is absolutely normal, and you can increase around 8 to 10 kgs safely during pregnancy. So, first is you should not be overweight. Second important thing is preconceptional folic acid. A very, very vital role of a folic acid. 3 months prior, they should be taking any simple folic acid. It's a very cheaper drug. Don't go for a fancy things. A simple folic acid, 3 months. It avoids anomalies into the brain of the baby. So very important. Third thing is yoga, meditation. Now, if always, another stress factor which happens is the patient says, I'm trying for last 2 months and I'm not even getting stressed. If you have a regular cycles, try to have your relation. The ovulation happens in the mid-cycle. So if you have 28 to 30 days cycle, the ovulation, your egg release will happen between 14 to 16. So if you have a sex in the end of the menses or a start of the menses, and if did not happen in the mid-cycle, then the pregnancy will not happen. We are not animals. At the end of suppose 100 couple get married on 1st of January, they don't use contraceptive, go for honeymoon, and doesn't mean all 100 will conceive. At the end of 3 months, around 40% conceive. At the end of 6 months, around 60% conceive. At the end of 1 year, only 85% conceive. So
All right.
one should have patience.
Ma'am, would you then recommend that if you have normal cycles, just have contact with your partner every 2 days near the time of your ovulation? Or, some people do this temperature tracking.
No, don't do that.
They monitor the temperature, and then when a spike comes, then they time the intercourse. Is that more stressful? Does it work better?
I tell my patient, please don't do that, because that is more stress. And because of the stress, you are not ovulating, your temperature monitoring is not helping you, urinary LH is not helping you. Simple way is remain positive. Think that if you start planning from today, in a year, sometimes you will conceive in any month.
All right.
Second thing is the life of egg is 12 hours, while the life of sperm is 48 to 72 hours. So from 12 to 18 days, try to have 4 to 5 times relations. That's more practical.
All right. So it's better to keep a lot of sperm ready for the egg whenever the egg is ready to come, right?
Yeah.
Okay, ma'am, one more question coming in is diabetes harmful during pregnancy?
Absolutely. Diabetes can cause abortions, genetic abnormalities, brain abnormalities. But does that mean diabetic patient cannot plan the pregnancy? No. Pre-pregnancy, they should make their diabetes level absolutely under control. And if their diabetes is strictly under control, then they will have the course as that of a non-diabetic patient during pregnancy. So they should visit to the obstetrician who has good knowledge. She has to have a diabetologist in the team and fetal medicine consultant who can monitor. Develop the confidence that you can have a healthy baby.
Ma'am, what are the general lines of treatment for diabetic women or women who develop gestational diabetes during pregnancy? How are they treated? Do they take insulin injections? Do they take metformin? What is the usual line of treatment?
Metformin is safe in pregnancy, but if their need is beyond the metformin, having anti-diabetic tablets, then they need to be shifted on insulin. And sudden shift on an insulin, it is too damaging to the patient. So I prefer them have a weight loss, have their diabetes strictly under control, their HbA1c preferably below 5.8, at least below 6, And then you plan during pregnancy with strict control on the diet and on the
Okay.
diabetes.
Right. Ma'am, another question coming in is, can PCOS be caused by stress?
PCOS is not caused by stress. There are many other factors, but the stress can worsen it because stress will give obesity, and obesity will enhance your polycystic ovaries. So,
Mhm.
all polycystic ovaries patient, there are so many other factors: the lifestyle, obesity, stress, and the genetic factors as well. So, don't have stress, don't have obesity, don't have a lifestyle. Let me tell this young generation of India, avoid smoking and alcohol because they are financially independent at age
Mm.
of 25. They don't need money from their parents for smoking and alcohol. I see that happening left and right, and this is more damaging than PCOS itself.
Right. So, ma'am, when you spoke about advice on how to take care of reproductive organs and how to, plan for conception, then would you say that, a few months before you actively start trying to conceive, start having folic acid, start exercising regularly, control your diet, get rid of these addictions? Is that the way to go forward? Or should one go through investigations to see if the reproductive organs and the hormones are in place?
No, visit to the obstetrician is important, just not to get scared off. It is
Mm.
just to get proper advice whether your weight is good. Preconceptionally, you should check not only your weight, not only your sugars, not
Mm.
only your uterus, but also certain viral group of infections like toxoplasmosis, rubella, because in India, people are still not taking rubella vaccination. And if they catch this viral infection during pregnancy, it can cause damage. So if you visit, any patient comes to me, we have here couple coming together for
Mm.
preconceptional counseling. I love it because I can make their pregnancy go smoothly. I can make them conceive naturally. We can make them off the stress, off the weight, off the
Mm.
smoking, off the alcohol, all these things, and they can have healthy baby in hands of healthy mother.
All right, ma'am. Thank you so much for joining us today and answering so many questions. If any of your questions are still left unanswered, we will try to take up all your questions in our next show. Do keep sending them to us, ma'am. Thank you so much for joining us today. You can connect with us on WhatsApp also and send us your question. Do remember to like our page and drop in your comments. Send us messages if you have questions. And don't forget to follow us to stay updated on all your concerns about health and well-being. This program was supported by Bharat Serums and Vaccines Limited. Thank you, ma'am, for taking the time out and joining us all the way from Pune and enlightening all our viewers on what they can do to keep themselves safe during COVID, how to plan their pregnancies, and how to stay stress-free. Thank you so much.
One more important thing, prayers. We did not talk about it. It is very
Hmm.
important. Prayers have power. So always have meditation and protect yourself. Thank you.
Thank
And
you, ma'am.
I
On
thank
those last words, we thank you for joining us. Lots of important tips coming in from ma'am on how you can improve your chances of pregnancy and conception. We will be back with another special show on women's healthcare very shortly. To follow us on Facebook to get all the updates on our upcoming programs. Keep sending us your questions. We have our specialist coming in to answer all your questions, and we will include them in our next show. Till then, stay at home, eat healthy, sleep well, and keep giving your mind and soul a daily dose of positive thinking. Don't forget to maintain personal
I think your connection got off.